welcome back to YouTube, the Edmonton Dermatology channel here on YouTube. Thanks for joining us. Today we're going to be talking about fillers in depth. And I'm here with Andrea.
Hello again.
She's a registered LPN here at the clinic. And we're just going to break down this topic even more than we've done before, and maybe it'll be a fit for you and what you need for your skincare.
Absolutely.
Yeah. So I have a quote from John Ray, and he says, "Beauty is power. A smile is its sword." But when we smile, we get those lines. The more we smile, the more we show. So it's kind of nice to maybe turn back the clock a little and,
keep smiling.
And exactly, keep smiling. That's right. Not worry about the lines that happen. In the United States, the use of fillers soared from 1.8 million procedures in 2010 to 2.6 million in 2016.
Huge.
That's huge. Yeah, that's coming from the American Society of Plastic Surgeons. So that's a big jump. Do you have any interesting anecdotes or stories about fillers off the top of your head?
I mean, fillers is something that can pretty much meet for anybody. Yeah. Really. It all depends on what you're looking for specifically. If there's an area of your face that you're not happy with. Yeah, it's one of those things that's so versatile that it's pretty good for anybody.
Nice.
Yeah.
Soon I'm going to get some myself. Okay, so then let's back up a little. What are fillers used for?
So fillers are used to help essentially refill the fat loss in the skin. So we all know that there's 3 layers to the skin, right? So you have your epidermis, which is what you see on everybody. Your dermis is your second layer, and your fat cells are at the bottom. So in the face, unfortunately, as we age, we actually lose that volume of fat cells in our skin. So they kind of die off. Or they become just so weak that they don't really hold their contents anymore. So they aren't plump. You don't have like the happy high cheekbones. You don't have the full cheeks anymore. And that actually causes a problem for the other 2 layers of the skin, because now they don't have anything to hold on to. So of course gravity starts pulling in, and so filler goes in and actually just kind of helps out with that fat loss. Okay. So it's replacing it essentially, just so that your skin's able to hang on to that shelf again. And it actually helps plump up your skin as well. So you're getting that fuller cheeks, cheekbones are kind of back. Sometimes the temples can sink in as we get older too, so we can get that kind of smoothened out as well.
Okay, so fillers, from what I remember you saying, where on the face?
Pretty much from here down.
Okay.
Okay. Now, of course, the eyelids don't count for that, so we're going right around here. Oh, okay. So we don't do too much in the eye area, but essentially from here down.
Okay. Yeah, good. Okay, what do fillers, can you go any more in depth about what fillers do to the body?
Absolutely. So fillers, when injected, is not a systemic thing. When we inject it, it stays in the area that we put it. Awesome. Yeah. What fillers is essentially is hyaluronic acid. So everybody out there, you're probably seeing a lot of commercials from the over-the-counter people about hyaluronic acid. Hyaluronic acid has actually been around for a long time. So that is what fillers is essentially made of. Hyaluronic acid is a molecule that is in our skin around the collagen already, and it's water loving. So it loves to attract water to the area, and that's what our collagen uses to feed. Okay. So filler, not only is it helping with that fat loss, but it's also feeding your collagen to make it stronger. Okay. And again, because hyaluronic acid is water loving, it's attracting, again, that water, that nutrient. So that's how you get that bright glow to your skin after a filler injection.
Oh, nice.
Yes.
And what are some of the side effects of filler?
So side effects of filler, there isn't too many, again, systemic. It's mostly just localized. So of course you need to do your research on who you're going to see to do the injections. There's lots of nurse injectors out there that are highly trained. There's lots of physicians out there that are highly trained, but you got to make sure that they are well practiced. Look at their reviews, figure out like if that's the person for you. Go ahead and do a consult, and if you're not feeling 100% with that person, then that's a flag to me. If you're not comfortable with the person that is going to be doing the treatment with you, maybe you need to step back and look and try and find someone else. So the biggest side effects with fillers is in the localized area. So of course, anytime we poke someone in the skin, you're going to have a little bit of a red dot. You may get some bruising afterwards. There is a little bit discomfort after the treatment, only because we were kind of working around in there and we just put something into the skin. There is also a very rare occurrence of if someone who is not well practiced can actually inject filler into a vein. which is terrible, terrible. It happens very rarely though, keep that in mind, but there is that slight risk. So of course, if we inject filler into a vein, it actually occludes the vein, which is a bad thing, right? Because then you lose all that blood supply to that certain area. There is a way to reverse it though.
Oh,
it's called hyaluronidase. It's an injection that is used. It's an enzyme that actually goes in and eats up hyaluronic acid, which we actually have hyaluronidase in our body already. A cool fact is this. Hyaluronidase is something that is a free radical already in our body that goes around and eats our hyaluronic acid. So our body's pretty much eating our own hyaluronic acid, so if we replace it with the filler, we get the more
results we want.
Yeah, we get the hyaluronic acid. It's good. So hyaluronidase is also used to break down filler. So if, let's say, you go and get a treatment done and you're not too happy, you maybe look a little bit, asymmetrical when you really want to look more symmetrical, hyaluronidase is there to help with that, but it is also there as an emergency need as well. Unfortunately, emergency room doctors, they don't know this because they don't study this type of medicine, of course, because they're super busy with everything else. They have to know all the other stuff for emergency cases. So a lot of the times, and I've seen this a lot in the States and Australia, where patients are going in to emergency rooms because they have something going on after a filler injection, I highly recommend you actually speak to the physician that did it. Even if it's after hours, just make sure that they somehow give you a phone number to call for after hour emergencies. Just because it's something that's, it definitely needs to be dealt with right away. Unfortunately, the emergency room doctors don't know what to do about it. So please call the person who injected.
Yikes.
Okay.
So, I'm going to ask this question next because it kind of goes along with what you just said, but what kind of certification should that administer fillers have?
So essentially it needs to be a nurse. So it could be an LPN or an RN. And you're more than welcome to ask them, how many injections have you done? How long have you been doing this for? Same thing with physicians. Like absolutely there's family doctors that do injections, and some of them are fantastic at it. Some of them might be a little bit new at it. But it's all that consultation, making sure you're going in there and meeting the person. And if you're feeling like flags are waving, then maybe it's time to go take another look. But you are more than welcome to ask. So it has to be a nurse and they have credentials. You can actually look us nurses up online with our colleges by our first and last names to see if we actually are active, which is cool. So there's CLPNA for the LPNs, CARNA for RNs, nurse practitioners, they're a part of CARNA a little bit as well. They have a branch off of CARNA. So those three, absolutely, as long as they're nurses. Family doctors, absolutely, they're allowed to do it. They get extra training and stuff like that they do. Dermatologists, we're dermatologists. We have them here. We have two of them that do the injections for us. We also have a nurse injector. She's an LPN. And then plastic surgeons, they do it as well.
Right.
So all those credentials, and again, you can actually look up doctors online as well with the College of Physicians and Surgeons, so you can actually see if they have any reports on them as well. So do your research.
Yeah, thanks for all that information for us to be able
stuff.
to look it up. Yeah, that's great. Okay, going back to the fillers themselves, how long do they last?
So fillers, it depends on where they're injected. So injection of kind of up here and into the jawline, we don't actually move a whole lot there. As you can see, mostly we move right around here. So these tend to last for about 12 months.
Oh, wow.
It lasts a long time.
Yeah.
Whereas areas that we move a little bit more, so in the lips, the nasal labial folds, they tend to only last about 6 months. Okay. Just because we're talking, smiling, laughing, all that stuff, it tends to move it a little bit more and break it down faster.
Okay. Yep. Okay, what is the difference, I guess, between fillers and Botox?
So fillers, like I said, fill in areas where we've lost volume. Botox essentially helps suppress movement of muscle. So essentially in areas like in the glabella here, in your forehead, I got bangs. Essentially, we always raise our eyebrows and squint like this. That actually has muscles moving that. So Botox helps inhibit that movement. So they actually work in two different ways to help reduce fine lines and wrinkles.
Right, to turn back that clock. So what age is recommended to get fillers?
Any age, actually. Obviously, if you're in your early teens, Probably not.
Probably don't even need
Sorry,
it. Yeah.
ladies. Usually in the early 20s, absolutely. A lot of the girls love to get their lips a little bit bigger. Not at that time do you really need into the cheeks at all because you're still young. You still have those fat pads. But pretty much, yeah, early 20s all the way till whenever you decide to stop.
Yep. Can fillers actually make you look older?
No, they cannot. As long as you are maintaining the treatment, you will always have that same type of look. Now, you don't look frozen, of course. You're still able to move when you have filler injections. It's a fluid substance. It's not something rock hard. So it's a fluid substance. You're still able to smile and stuff like that. But it won't make you look older. Now, of course, age happens. We can't reverse that yet. Who knows? Essentially, you will notice with time, wrinkles will get more and more and more. But it's all about that prevention. We can always make it less quick. We can slow it down a little bit. Just so that you feel, more confident in yourself.
Yeah, that's good. Can I wear makeup after I've had these fillers? Like right after or?
Yes, as long as you're not too aggressive when applying makeup.
Okay.
Because when we inject it, it needs to find its settling point, right? So we inject it into an area, and I keep pointing at my cheeks because it's the easiest. When we inject into there, we usually kind of massage it into place, but we ask that you don't touch it because if you start massaging it, it's going to start moving everywhere. Okay, so we usually ask that within a day or two, don't massage the area. Try not to sleep on it because it will move. You of course can sleep on your back. But makeup, absolutely, you can put it on as long as you're not rubbing stuff in, right?
Okay.
So if you're just gently kind of powdering after, we can totally fine to do that. And we actually do touch-ups after our filler injections here. We do a bit of a makeup consultation if patients want it right after.
Yeah, that's great.
Yeah.
Nice option. Then you don't have to worry about going too aggressive. So
exactly.
That's good. Yeah. And okay, you've kind of already said this, but wrinkles, do they get worse after having those fillers? Do the fillers cause the wrinkles get?
No, the fillers don't cause the wrinkles. Yeah. So hyaluronic acid, like I said, is a natural thing in our body already. And unfortunately, time, we cannot reverse it. So it is something that eventually you'll notice the wrinkles will continue to show, but they may not be as deep or severe as some people who haven't had fillers.
Okay, good to know. Well, thanks so much for answering all those amazing questions.
Welcome.
I'm ready to get some fillers myself. I'm always excited after I hear about this. Thanks for joining us here on YouTube at the Edmonton Dermatology, Skincare, and Surgery Center. We have everything.
All of the
and
above.
Cosmetics, and join us by subscribing. Get the next video that we're going to come out with. We have lots more coming out. And don't forget to like the video if you got some good info out of it. Thanks. Have a great day.
Thanks. Bye.